We are encouraging patients to consider using telemed, especially if they're still very scared, especially if they're high risk. My name is Dr. Olga Swanson. I'm from Houston, Texas, and my practice is in the general Houston area, and I practice gynecology. Telemedicine is wonderful for simple conditions. It's wonderful for triaging conditions. However, in my situation, it was a reasonable first step, but not having an avenue for follow-up because someone said that that was not an essential office perhaps to stay open, or somebody felt that they weren't essential to stay open. You have to have an avenue for a patient to come back and say there's a problem. In my office, for instance, we've been doing telemed since the third week of March. We're still doing telemed, and we are encouraging patients to consider using telemed, especially if they're still very scared, especially if they're high risk. However, throughout all of this, I can tell you that my office has stayed open the entire time. We were adhering to the guidelines. Our patients felt safe coming into our office. We were spreading out our schedule. We were social distancing. But at the same time, if their condition was not improving with telemedicine, they knew that they could always come in, and they were given the choice. We have had some instances like this in our office. We have typically seen these patients on telemedicine, and most of the time they were able to be addressed by telemedicine. In the few instances that they were not, or that they did not improve, we would normally have that person come in right at 7:30. We've limited the staff in our office, and clearly masks and temperatures and questionnaires. There's no more waiting room in my office, so I would encourage these patients to seek out an environment that they're comfortable in, but I would certainly not advise them to delay their care, and I would certainly advise them to go to their doctor first, because they're much likely to be exposed to a lot less people at the doctor's office. We didn't want our patients to have the consequences that I did. And at the same time, I didn't want to be sending people to the emergency room in this kind of an environment.